Hello everybody, I'm back. Dr. K.K. Agarwal here, President, Confederation of Medical Association of Asia and Oceania, past National President, Indian Medical Association, and President, Heart Care Foundation of India. And you are watching Medtalks with Dr. K.K., 211th non-stop Medtalks and 1688th COVID episode. Let's have the headlines of the day. India has vaccinated over 8 million beneficiaries against COVID-19 in less than 28 days. Today is the day for the booster dose of COVID-19 vaccine for the healthcare and frontline workers who were given the first dose on 16 January at the launch of vaccination drive in the country. The total active COVID cases in the country are now 1.36 lakh. More than 1 crore people have recovered from the illness. The national recovery rate is 97.32%. A joint WHO-UNICEF statement has said that of the 128 million vaccine doses administered so far, more than 3/4 of those vaccinations are in just 10 countries. That accounts for 60% of the global GDP. Almost 130 countries with 2.5 billion people are yet to be administered even a single dose. Antibodies against the novel coronavirus disease may last up to 8 months or longer after the vaccination, according to All India Institute of India director. Let's go to the topic of the day. Introduction to the Indian program of UNESCO Chair in Biotics and lessons learned from the webinar series on COVID-19 pandemic organized by UNESCO over the last many months. Before I introduce the faculty, I have the customary of doing, it's customary to do Atithi Devo Bhava, and for that we need to wash our hand. And that's what Corona has taught us. So we take the sanitizer and we say Suman K, S for Seedha, U for Ulta, M for Mutti, A for Angutha, N for Nakhun, and K for Kalai. Once you have done that, we are ready to welcome our special guest. And that's Dr. Mary Mathew, currently the Professor of Pathology, Coordinator Center for Fetal and Perinatal Pathology at Kasturba Medical College, Manipal, heads the Indian program for UNESCO Chair in Bioethics, Haifa. She is an International Council member, Department of Education, International Network of UNESCO Chair in Bioethics, member of International Forum of Teachers, again UNESCO Chair in Bioethics, life member of Forum for Ethics Review Committee, India, MU Philippi Famer Fellow in Interpersonal Education and Practice, member of Towards Unity of Health Network in Social Accountability, Fellow of the International Institute of Organizational Psychological Medical Medicine, ex-member of Institutional Committee, Kasturba Medical College, and ex-Kasturba Medical College Coordinator for Ethics for Undergraduate Medical Students. She is the resource person for webinars and conferences in pathology and bioethics, both nationally and internationally, and moderated over 35 webinars for COVID-19 pandemic, more than 100 publications. Her areas of interest include pediatric pathology with special interest in fetal autopsies, renal pathology, gynecology, oncology, and bioethics. So welcome, Mary, to be here with us. We would like to listen from you about the Indian program and about the lessons learned when you moderated over 35 such seminars internationally. And after that, we will make it open to the public. If they have any questions, they can ask. And when the public is there, I will also call one of your students, Dr. Meenakshi, to come and interact and tell her experiences, that why does she remember you all the time in her practice. Over to you, Dr. Mary.
Thank you, Dr. Agarwal, and really wonderful to be here on this platform, which has, I believe, thousands and thousands of viewers. This is an educational platform, and I'm glad we have something like this in India. Today, I'd like to talk about what we are doing at the Indian program of the UNESCO Chair and why we decided to have these webinar series during the COVID-19 pandemic. So, may I have the first slide, please? All right. So I'm the head of the Indian program of the UNESCO Chair in Bioethics, Haifa. Just to tell you a little bit about this chair, this was started in 2001 as an agreement between the then Director General of UNESCO and the university, the rector of the University of Haifa. And their main mandate was to spread bioethics education all around the world, globally, both nationally and internationally, developed and underdeveloped countries. And the reason for this was because they did two studies which showed that countries where ethics was being taught was not really translated into practice at the doctor patient interface. So they said we need to renew and relook at ethics education and bring awareness to the doctors regarding ethics in practice. Next slide, please. So the Indian program of the UNESCO Chair, their mandate was to conduct, first and foremost, establish units in various parts of India. We have about 75 units currently in medical colleges and universities. What we thought was very good and very novel, which has never been established by the UNESCO, was a student wing of the UNESCO Chair, of which India has 50. I'm really proud to say that India has 50 student wings of the UNESCO Chair in Bioethics. We also have collaboration with the National Board, with the MSAI, that's the Medical Student Association of India, the IMA, Indian Medical Association, the Association for Health Science University India, the Rotaract Club, the Dental Council of India, the Pharmacy Council of India, and many more. Now, what do? After setting up these units, the first thing we do is we train the teachers, because as you know, right now, the ATICOM module has come in where ethics is being taught vertically and horizontally to our medical students. India is a bit late when it came to teaching ethics and introducing it into the curriculum. We teach, and right now, not many are trained to teach ethics in these medical schools. So what we do is we go to these universities and conduct a program which is called a 3T program. The 3T program stands for to teach, to train, to teach, and transfer knowledge in education. And as of now, from 2013, when I took over as the head of the Indian program, we have trained about 3,500 teachers in bioethics. We also run certificate courses for medical students, nationally and internationally. And we currently have 2 batches of international students who are taking these courses. Next slide, please. Yes. So what we thought was how to drive ethics into the curriculum. We thought the students were the best to do it for us, generate an interest in the students, and they'll take it forward. Next slide, please. So I'm talking about my college, Kasturba Medical College, Manipal. These were my 2 first students who were the co-chairs of the student wing of the Bioethics, UNESCO Chair in Bioethics. And they have done exceptionally well in life. This is much years ago, maybe about 3-4 years ago. They had written an article which was on sowing the ethical seeds early in our medical education. And they took this ethics forward, and they published this article in Global Bioethics Inquiry, which is a scholarly publication of the UNESCO Chair. And right now, they are. Parul is. She is now working with the WHO, and Sharon is a resident in New York. Next slide, please. So, how did we take the cause of ethics forward? We numerous student talks, and it's marvelous to see how much our students can do when you give them a platform to talk on various ethical issues. Their very first talk by the co-chair was the white coat, the good, the bad, and the ugly. So they know right from the start what exactly um, they are in for when they wear that white coat and they wear their stethoscope. We had a lot of case series discussions on euthanasia, on professionalism, and many topics of the Jane Doe case, Baby Doe case. Everything was, all this was done after their school schedule, that is at 5 p.m. Next slide, please. We also had our faculty talking to our students regarding ethics. And one of the first things, if you remember, the Ebola virus, when it struck in 2014, the UNESCO chair brought together the entire Kasturba Medical College and delivered a talk. We brought in our virologist and delivered a talk on the Ebola virus and what are the precautions we need to take and prepare all the faculty for this virus. We also had talks on something which was a burning issue that at that time, which was female genital mutilation that WHO had taken up and which is being practiced in some parts of India. We had speakers from out of our university coming and giving these talks. Next slide, please. So what did this do for our students? They were able to publish articles, and this is amazing because we, when we were doing our medicine, we were never taught how to write a paper or to do research. But this was a platform for them to publish and to make their resume sound good, and also research, introduce them to research. So this is my student. His name is Chetan Jonki. This was when he was a second-year student in pathology. He gave this talk on ethical aspects of obesity, which he translated into a paper. And very proud now he's on his way to being an orthopedic surgeon. Next slide. We had many activities. We had, other than student talks, we had debates, workshop, faculty training, intern. We trained our interns, we trained our faculty, we had competitions, we had role plays regarding ethics. Next slide, please. We had a lot of workshop, international, national collaboration. We brought in the experts from ICMR to come and speak to our students regarding ethics in research. Next slide, please. This was our newsletter, and this is there. Most of our units over in India have a newsletter. We introduced this is a monthly newsletter where we spoke about a lot of ethical issues. Next slide, please. And these are our students doing very well. They were able to compete in many competitions, present papers, they join in national and international levels. Next slide. And we had students who won the UNESCO grant to attend conferences and also win prizes for on the World Biotics Day. Next slide. And this is the World Biotics Day that we celebrate all over the world. It is on 19th October. And every unit holds a program for 1 month where they have speakers, faculty giving talks, debates, collage competitions, skits, posters, painting, every sort of activity that you can think for ethics. Next slide, please. And this is a project which I had initiated my students here. These are my second-year students. It was called Helping Hands, Helping Minds, where we took our students to, this is a residential school in Manipal. The children there are from the labor class children who parents go out for work, and the children stay here and study in these schools. So we were able to take our students and do a lot of activities with children. And this was the aim was to hone their social accountability skills. Being a doctor is one thing, but you are accountable also for what you do in the society. Next slide, please. And this is my student writing about the reflections of being the UNESCO chair co-founder. He said, as a co-founder and co-chair of UNESCO Biotics Student Wing of KMC Manipal, One of the projects entailed organizing a street play for underprivileged children at a summer vacation camp in residential school in Manipal. This was part of the youth program of the chair, Helping Hands, Helping Minds. A group of second-year medical students did a street play in Kannada, that's our local language, to educate children. It was a wonderful initiative. Community service is an imperative part of medical profession, and doing our bit can make a difference. It also opened my eyes to the situation in India and the burning need to take steps to help out and make a change. As someone who is going to work in a less affluent area in New York, I am glad that I was able to participate actively in community service while in medical school and was able to help spread awareness among those with less access. That is Dr. Sharon Mirchandani, who is a resident in New York. Next slide, please. And this is one of the largest conferences that we have ever held. This is our first conference in bioethics in November 2019 with 3,600 delegates, with paper presentation of over 1,000 and papers and posters, 16 keynote speakers, 36 plenary sessions, and national and international speakers, 12 pre-conference workshops, 3 workshops during the conference, and this was in SRM Institute of Science and Technology in Chennai. Next slide, please. So that was about the Indian program. Now, as the head of the Indian program, I have moderated 35 webinars. Nothing compared to what Dr. Agarwal is doing, of course, but it's really a pleasure to be part of these webinars. Now, why did we want to do these webinars? We realized early when the lockdown happened in India around March, towards the third week, the end of March, we realized that everyone was isolated and no one was in touch with each other. And what better way to keep in touch is to have a webinar, and to keep, especially since online platforms were available, and that was really a blessing that we had the online platform to keep us all connected, to keep us aware of what is happening during the COVID-19 pandemic, so that we were not isolated at all. We conducted 35 webinars in various disciplines. We did medical, nursing, dental, pharmacy, allied health. We did one with school teachers, with children, with headmasters. We even had one on religion and its role. What can religion do to help during this pandemic? And we had economists coming in to speak about the economy, what the pandemic is doing about the economy. Next slide, please. So these are the 35 webinars, which I'm sure you can't make out because of the print, of course. But the first one, what we did was we did ethics of mandatory and voluntary intervention, non-pharmaceutical interventions, isolation, quarantine, social distance, and closure. And this was one of our very first webinars, and we spoke about this in detail, what it did to people being, especially in India. What happened was the lockdown was declared within 4 hours, and how it created panic in the country, and how people rushed to the pharmacy to get their medication because we didn't know how long this pandemic was, and the struggles that people went through just hearing about this pandemic, and about this lockdown. Then as time went on, we realized that there's a lot of resources which were not available. People were falling sick with COVID-19, but then so were the healthcare workers. We didn't have enough healthcare. We didn't have resources. We didn't have enough. PPE became an issue. Who do we give the PPE to? How are we going to ration all ration ventilators? What do we do when we are overwhelmed with the patients who need ventilators? Then we talked about ethical dilemmas which confronted health workforce in the wake of COVID-19 pandemic. This was a burning issue. It was a sad issue where doctors came in and talked about how difficult their lives have become, because not only were they toiling for patients, but they were also getting beaten up and ostracized and stigmatized because of this pandemic, and because I'm sure many of you heard in Maharashtra, residents were thrown out of their apartments because they were told that they were carrying the virus. So these issues were discussed at that point. Then we talked about the ethics of humanitarian and social aspects of responding to COVID-19 pandemic, especially in India. Something the world has not seen is about the migrant workers. What happened to them? We never anticipated a situation like this. What happened to them? And the media showing about them walking and people falling sick and dying on the way. What happened to them? This was a sad situation that we saw, especially in India, which we had discussed about at that time about what do we do when you're so vulnerable and when you're so poor, you can't afford even the sanitizer that Dr. Agarwal was showing us. We had mothers who came in and said, what should I choose? Should I choose a sanitizer, or should I choose food for my children, or should I choose a mask? What is it that which is important? How do I stay alive? So these were the issues that came in. And then we did one on medical education. At that time, as teachers, we didn't know what to do about our students. They went, some of them, majority, it was actually holiday time and they had gone home. But we did have our final years here, and they were scared. They were worried about their future. We didn't know how to comfort them. But we did start our online classes, and that was really a blessing that we could keep track of them. And I remember when I took one of the classes, where I said, "How are you all doing?" And I got this response from one of the students. She said, "I hate this virus. I just wish this whole thing would end." And there were students who said, I just don't know what my future is. What am I going to do? And these were signs that we picked up, and we said, no, they need counseling. We need to be careful. We have to make sure that nothing happens to our students. So we did have the mentee system, where we kept in touch with our mentees so that we knew they were doing well. But it was really for the final year medical students, it was a sad state of affairs, because they had no contact with patients. They had to write their exams, and they didn't get enough experience when it came to seeing patients and for their to go for the exams. Then we we spoke about the value of life. Whose life is it? Whose life is worth much more than the others? Is it because you're poor that your life is valueless? Because you are old, your life has no value? Should the old be sacrificed for the young? So these were the issues that we talked about. And then we brought in the dental faculty, and they said the problems they had because they couldn't do their job. Of course, they could not even those who were in private practice or in government service. They could not practice, obviously, because of the risk of transmission, and they were worried for their future and their families. And also the patients who had dental problems were not able to access care. Another webinar that we did was on the ethics of reopening the nation and the economy. We brought in economists, and we brought in the healthcare faculty, the health professionals. And of course, at that time, and even now, this pandemic is actually a catch-22 situation for every country in the world. You reopen the economy, then you risk the chance of spreading the infection. You close the economy and have no businesses, you risk the chance of the country not doing well, but also people not having jobs. And that was a very big issue. And one of the saddest issues that we heard about was doctors who were working for half the pay, and or no pay at all, because private institutions never had the money to pay them. Worse still were the nurses and allied health staff who never got paid. These were the sad issues that we heard during these webinars. Then, of course, we did one on schools, and we brought in children, and we asked them how were they doing and what were they doing for the lockdown. And some of them, initial part of the lockdown, they were all happy because they don't want to go to school. But after some time, it became difficult. They said, no, we want to go to school. And I had medical students, my own students, who were so naughty in class and were always bunking class, suddenly saying, I want to come back. I want to come back, madam. I want to, have a face-to-face session instead of this online classes. So these were the issues. But then we brought in headmasters and teachers, and they told us their problems, that when we're conducting these online classes for the children, um, you have in one house, many houses were like this, there was only one computer. The father was working online, mother was working online, and then you have two children also using the computer for their school. So it was a challenging situation for many of the parents, and teachers were requesting, the headmasters were requesting, if anyone had any computers which was old and they were not using, please send it over so that our children can get access. And you've heard the stories in Kerala where one of the girl students committed suicide because she could not access the online classes. So after that, Kerala went in and had made sure that there was internet connection in even in the remote places. Then we had one on quarantine, the impact on family life. And let me tell you, all these webinars, it was not only for India, it was world over. We had practically every continent, we had speakers, and we were able to compare, and the problems were similar. Only thing, it may be the degree may have been different, or the pandemic. If you look at Africa, was one of the last countries to where the pandemic was affected. So their problems came in much later than India and the rest of the world. So what happened was, during the family webinars on effect on families, we had psychologists coming and telling us that they had patients who called them up and said, I'm just waiting for this pandemic to get over so that I can just divorce my husband. I cannot see him anymore. So whatever small differences in families were magnified by just these lockdowns and this closeness of being together. And for some parents, they made it fruitful. It was a time when they could spend time with their children, but for others, it was extremely difficult. And especially in joint families where you have 5, 6 people, it was, and also elderly people living in the house, it was just sheer fear, especially the healthcare workers, because you're scared when you go out and come back, whether you will transmit the infection to your parent, to your father, to your mother, or to your grandchildren. These were the concerns, and concerns with the healthcare workers, as well as for the parents and for the family. Then we brought in the pharmacy profession. One thing good that came out of these webinars, we had at least 4 webinars on the pharmacy and their role in during the COVID-19 pandemic, how they can step up, especially the community pharmacist, and play a role in COVID-19 pandemic. And one of the good things, like I said, that happened, where we were able to generate a white paper on COVID pharmacy, the role of pharmacist in COVID-19 pandemic, and this has been circulated by the World Pharmacy Council. And similarly, we had on nursing, and that was really a beautiful seminar, because people keep talking about doctors, doctors, doctors. But actually, in this COVID-19 pandemic, the foot soldiers are the nurses. They have also faced the brunt of this pandemic. And in one session, I just asked them, does anyone know what is the what are the numbers of nurses who are being infected, or how many have died because of COVID-19? And there was no other than Tamil Nadu, I don't think any other state in India had any record of the nursing faculty. So and then we had allied health physiotherapists, allied health professionals coming in, talking about their problems from Saudi Arabia, from Egypt, and how it was so difficult for the patients to access care, especially the patients, those who were in speech and hearing, in ENT. How the mask was a deterrent for the deaf people. They had to wear the mask. The doctor, the health professionals had to wear their mask. But how do you communicate to a person who is deaf? Because usually they lip read. So these were the problems that they had faced. And then we did one on public health. Are we ready for the next pandemic? And if you, one of the things that I had said during those webinar was in 2019, the Times Magazine released an article showing the preparedness, which country was most prepared for the pandemic. And it was first was USA, followed by UK. But after the pandemic struck, we know that not a single country was ever prepared for a pandemic. So what are we doing now? Are we going to fall back? Are we going to take it easy once this pandemic gets over? Or are we preparing ourselves for the next, if do we have any protocols or anything in place should another pandemic happen? So this was what we had discussed at that time. And we talked about what is called as biopower, politics and medicine and its role in healthcare in this COVID-19 pandemics, how politicians have failed countries. And USA and UK were speakers from USA and UK were open about saying that the government has failed their people. And that is why a lot of them had died. So politics also has a role. We did one separately on religion. And the reason why we, even though religion is a very controversial issue, the reason why we did it is we said, can religion play a role to mitigate the effects of COVID-19 pandemic? Religious leaders have a place and a role at times like this to make sure that their flock, their people are looked after. And then we did one, the second last webinar that we did was on bioethics and the Holocaust, because it was the World Doctors Day. And we did on the reflections of the legacy of the doctors' trial in Nuremberg, how doctors who were supposed to be caregivers turned into monsters, and how research can be in the guise of research, how doctors can misuse their privilege, especially in COVID-19 pandemic. I'm sure many of us who are in universities, we still have to publish. And a lot of questionnaires you'll be getting in your emails, to about COVID-19 pandemics and surveys, and how most of them are actually is, did we get any useful information? And the last one that we had on February 7th was with Dr. Agarwal, where we talked about COVID-19 and the mutations, what is happening in the world regarding mutations and the burning issues of vaccines. Do we take it? Don't we take it? In fact, in the subsequent, maybe the next month, we'll be talking about the myths about vaccine and the controversies regarding, the virus originated in Wuhan, China. So these are some of the topics that we had discussed. And may I have the next slide, please? Yeah, so this was one among our first, where we brought in Dr. John Chisholm. He's the chair of medical ethics from the British Medical Association. And of course, you can see Dr. Agarwal and many other eminent speakers, where we talked about the effects of ethics of healthcare rationing in the wake of COVID-19 pandemic, the impossible choices. The next slide, please. And these two, the one on the left is the one we had on family therapy, on couples and families, what COVID-19 pandemic did. And the one on the right is a nursing fraternity from all over the world speaking about their experience. Next slide, please. And this one was the sweetest of all the webinars that I moderated, where we brought in school children. And you can see at the bottom row, children of different ages, and above them are all the teachers and the vice principal, the school principals. And we brought in psychologists and pediatricians, and why this COVID-19 was not so common in children. We spoke about all these issues. Next one, please. Next slide. And this is the latest that we had on February 7th on COVID-19 mutation. So it was, what did we learn from all this? that the problems are the same everywhere when it comes to COVID-19 pandemic. But one thing these webinar series did was connect us all together and give each other hope that we will get through this pandemic. And it was truly an amazing learning session for me, and wonderful to connect to people who I don't think, if COVID-19, the pandemic had happened, I would have never heard about these people. So next slide. Yeah, so thank you. This was the poster that won the best poster from our university for the World Biotics Day. Thank you very much. I'll take any questions if you have.
Thank you. Can I take the slide off, Rico? So thank you, Mary, for a beautiful description of your journey with COVID and UNESCO. So the thing which I want to discuss is, even after almost a year of COVID-19, in fact, it was 18th of January when I was in Malaysia and Myanmar the same day, and we had the first discussion on COVID-19 between 5 countries. Do you think why our medical fraternity till today is in fear, specifically now, initially a fear of COVID, now a fear of vaccination?
Yes.
What is wrong? What is wrong internationally amongst the teaching of the medical profession, that we were not ready to accept a change? A change means something unknown. The whole medical fraternity was shattered.
Yes, but Dr. Agarwal, you should remember, we are seeing this after 100 years. This is something in a lifetime that none of us have ever experienced. So naturally, fears are there. I can say for because I have an elderly mother with me. I fear for her because she is 88 now, and I'm scared that I will transmit, that I shouldn't transmit, rather, to my mother. That is one. And the thing about doctors is that, because you're worried about your family, you're worried about the financial aspect of it. Many doctors have lost their jobs, Dr. Agarwal. Many have, lost or are working in half pay. Are they able to support their family? These were the issues that was burning in their mind, and also the stress of dealing with COVID-19. The patients who were affected, they were all the mental trauma and the stress that a healthcare worker goes through. I don't think can be quantified in any way. And uh, that was the first thing. That was the fear. And then even for us in pathology, we had people walking around saying, please don't go near pathology department, the virus comes from there. So these kind of things, I don't know where they come from. So we had to say, we are not in pathology, it's microbiology. And microbiology was opposite our department. And we were also paranoid that we locked our front door and we asked all our staff to come from the back door. So why are we so weird? I think we're just so panicky when it comes to this virus. That is one. Vaccination, I should say, many of our staff have taken it. But what has happened right now is people are saying, okay, we are not seeing many cases. Why should I even take it? That is what is happening right now. But I don't think healthcare workers per se, we have not seen many refusal unless they have some comorbid condition. Other than that, I don't think there is a reluctance.
Any data about perinatal and natal placental studies as far as COVID-19 is concerned? Coming back to your heart.
Yeah, I know. In pathology, they have, because we get a lot of these placentas. In fact, I did get a COVID-19 positive placenta, but we didn't see any change from the usual, normal placentas that we saw. But then, of course, I'm talking about one experience. But there are reports regarding the changes. They're not very off. You can just say maybe it's associated COVID-19. There's nothing specific to say that it is actually because of COVID-19. But right now they do have antibodies where they're demonstrating the virus. We use IHC for that, where they demonstrate the virus in the placenta. So placental transmission is there. It is happening.
So let me bring in one of my colleagues working with me, Dr. Meenakshi. She was your student. So Meenakshi, share your experience about inflammation.
A very good evening to the to two of the most memorable teachers in my career. Ma'am, I was one of the lucky students who happened to attend your lecture on inflammation in my college days years ago. I still
And
remember
how many
vividly.
years? How many years ago was that? Which batch were
Oh,
you?
ma'am, I passed out in 2010, 2012. So, pathology probably happened 2.5 years before that. So, ma'am, I remember very vividly. I just stood on the podium in front of the class, and you told us to drop everything we were doing and just listen to you, because you said that we are going to do inflammation, and no matter what field you take, no matter where you go, you will encounter inflammation. Uh, it was made everyone take notes, and ma'am, that was very atypical for that time, because there were a lot of people who don't take notes in class. They just listen, or they just do something on their phone. You made every single student take a pen and paper. You said borrow from your friend, but take down the notes, because this is a very, very important chapter. And ma'am, we've been dealing with COVID patients, and every single day we talk about inflammation here. And I remember your words very dearly. Every single day we've been talking about inflammation. I just I can imagine you standing on that podium in that royal blue outfit, and talking about inflammation and how it's going to be one of the very important topics. And we are seeing that every single day with and working with Dr. KK Agarwal, who's so deeply into inflammation. We are running a campaign saying CRP less than 1, which is a marker of inflammation again. And I just wanted to give my 2 cents about how every student of yours remembers you dearly, even though they might not be communicating it to you.
Oh, lovely. I
So
mean, actually, the sad part is I have.
Yes, ma'am. I know you probably won't remember me because it was just a theory class and there are so many students. That's absolutely all right. But yeah, I mean, even people you don't know, they still remember you and remember how you taught and how you made us take notes. So don't stop doing that.
Thank
so
you, Dr. Meenakshi. May I know what is your field now? What are you specialized in?
Ma'am, I'm with Dr. KK Agarwal. I'm working with him. I'm practicing medicine at the moment.
Medicine.
Yes.
Lovely.
and basically practicing, her interest is in cancer and COVID. So
Okay.
why I called Meenakshi was because for the last 9 months we have focused on certain things. One thing we have focused is that comorbid condition in COVID means pro-inflammatory and pro-thrombotic. Anything which is pro-inflammatory and a pro-thrombotic will be a comorbid condition, because this virus converts pro-inflammatory into inflammatory and a pro-thrombotic into thrombotic. And that's what we are talking about the vaccine. Vaccine contains the same protein. So the vaccine also will convert a pro-thrombotic into thrombotic and a pro-inflammatory into inflammatory. Therefore, if you are in a pro-inflammatory state or a pro-thrombotic state, talk to your doctor to control your inflammation and thrombotic. Otherwise, even the vaccine can precipitate MI, stroke. We already have more than 23 deaths in India because of MI after the vaccine. That's all because a vaccine reactogenicity of the vaccine has precipitated inflammation. Inflammation has precipitated thrombosis, which has caused this infection. So day in and day out, we have now started a campaign called Keep Your CRP Less Than 1. That means low grade silent inflammation, if you control, then unexpected deaths will go away. The film actor Rajiv Kapoor, who died day before yesterday, could not have died. I am 100% sure nobody can die suddenly if the CRP is less than 1, because there is no inflammation, there is no rupture. The plaque will only rupture when there is an underlying inflammation. So with this campaign, we are talking about non-inflammatory lifestyle, non-inflammatory diet, non-inflammatory medicines. So if you keep your inflammation at the lowest, you will not get unexpected deaths. Deaths will still occur, but you will not get unexpected deaths because of inflammation. So that's what we are working upon. And every day when we talk about this, so Meenakshi says I learned
Inflammation.
information from Dr. Mary
Ma'am,
Mathew.
I still probably have my notes handy somewhere. I mean, I don't have it handy, but I'm sure they're lying around
Oh,
somewhere.
lovely. Nice. But
So
I think, Dr. Agarwal, this should be, publicly made note publicly, because I don't think many are aware of regarding CRP.
CRP less than 1 is the campaign. This helped me because being a cardiologist, we talk about low-grade inflammation. Then I was with Dr. Malviya for some time in immunology way back in 1981 when I learned about CRP. And now today, everywhere in the world, only one marker people are talking about, it's CRP. So if your CRP is high, even today I'm telling all my patients when they are going for vaccinations, first do your CRP. If your CRP is high, talk to us for a pre-medication. And we have been able to reduce mortality in COVID only because of the earliest marker is CRP. If you're going to wait for patient to deteriorate, the first marker will be CRP more than 10 on day 3, means this patient will head towards a ventilator, attack it there. And that's how we have been able to save all our patients. So that's all for today, Dr. Mathew.
Thank you.
Mathew to be here with us. It was nice interacting, and thanks Meenakshi to be here.
Thank you, Meenakshi. Lovely seeing you.
We will be back tomorrow again with another session. Keep watching Medtalks with Dr. KK. Namaskar.
Thank you.